Melissa O'Brien has been a doctor in Corner Brook since 2011, but she's closing down her practice here. She says that she's overworked, burnt out, and can't properly care for her patients. And she says that government is not doing enough for doctors like her. O'Brien runs this family medicine clinic every day, but the job doesn't stop there. Paperwork piles up.
So the work that I'm doing at home in the nighttime, it's astronomical. So you finish your clinic, you get home, you do some of your family stuff that you need to do. I have 2 children. I'll get the kids to bed, and then I'm back doing more work on my computer again until potentially midnight or after.
She tried a practice share approach, but her partner left for another town, a big government bonus. She's closing December 17 and can't find anyone to take over her clinic. Her patients will have no family doctor.
It was heartbreaking. It was the hardest decision I've had to make in medicine. It's this guilt-inducing decision of, you hear from the seniors, you hear from the 90-plus-year-olds, what you'd consider your pop, and say he's telling you that he has always had a family doctor and he's going to have no family doctor now for the first time in over 60 years, and it breaks your heart. And you think about the children, the young kids that are going to have to go sit in the emergency room for hours to be seen for things that you would normally just fit them in your clinic for.
She's going to continue searching for a replacement, but it's not looking promising. O'Brien says she can't compete with NL Health Services incentives and bonuses government is dishing out right now. She thinks incentivizing certain communities is the wrong approach. And there should be more focus on retention, not just recruitment.
The community family clinics that are working right now so hard to maintain the primary care for their patients are being ignored.
The Department of Health disagrees, saying it's committed to supporting family medicine physicians and addressing administrative burdens. In a statement, it mentioned the practice partners approach that O'Brien tried, without success, and the new family care teams government is trying to establish. In Corner Brook, a new family doctor who wants to join a fee-for-service practice or take over O'Brien's can avail of a $150,000 incentive plus a 2-year income guarantee. So what will O'Brien do? She has no plans on leaving her hometown or medicine. She will continue to work part-time at the cancer clinic and help out at the hospital when needed. Closing her family practice is not something that she necessarily wants to do, but she feels she has to. Colleen Connors, CBC News, Corner Brook.